everyone, I'm here today with Dr. Jason Thompson. Dr. Jason is a medical doctor specialising in research of crashes and injuries.
Yep. Health and trauma systems and transport systems as well.
And he's from the University of Melbourne. We're catching up to him today to discuss this whole COVID situation and an article that was written. And the article, you can find it here. It'll also be in the description below, and it is relating to the change in the name, in the blame game. That's really hard to say when you're in a hurry to say. The change in the blame game now from being more about the politics of COVID and how politicians can help us get out of this to being our fault. And I came across Jason after a tweet that I put out, which is also linked down there below, that certainly went viral for no real reason. So Jason, introduce yourself.
Thanks so much. Thanks Ed, thanks for having me. My background's in clinical psychology, my PhD is in medicine, and I'm a systems researcher, so I work at the University of Melbourne and I investigate transport systems, health systems, and I investigate crises as well. And I first got involved with Covid-19 last year when our team did the modelling to help Victoria get out of the second wave of the coronavirus restrictions. So we did the modelling with the phases on the way out of it. So I've been very interested in that crisis, the ongoing crisis, and I'm particularly interested in the politics of it as well, because that relates to the way.
Talk about the COVID side of things and the way that the blame is getting shifted now. And we are going to talk about the way this relates back to cycling as well, because it wouldn't be me if it didn't relate to cycling somehow. One of the topics you wrote about was the change from it being the government responsibility to a personal responsibility. Tell me, how did you come across that? What made you write that article?
A couple of months ago, I was tweeting a little bit about this because what you can see is a shift in global politics as different countries, especially the UK, the US, as their vaccination rates are getting up. Quite clearly before, it was a public health issue. Now, public health is about the way in which societies are organised. So, and the way in which those societies are organised and organise themselves is like a machine that produces health outcomes, okay? So, for example, for people who are interested in cycling, if you have a really car-based system, if your society is organised like that and you have very few cyclists, those cyclists are going to be at very high risk because they're just sort of outnumbered and they're not given priority on the roads and that sort of thing. So that's a social system. It's driven by the politics and the priorities of government, and it produces a public health outcome, which is high rates of cycling crashes. So you can't pull apart public health and government priorities and politics. They are one and the same thing. Society, public health is all about the big levers that mean that societies end up with different sorts of health or illnesses in the society. Might be diabetes because we've got lack of exercise or walking and cycling infrastructure and too many fatty foods, or we have too much. Might be cancers to do with the amount of tobacco that's in a society, or the amount of alcohol, or whatever it is. These things are big policy levers, or these can be affected by big policy levers which are driven by governments.
But it does seem to be that our politicians are playing a little bit of politics with the vaccine. Do you think that's going to end up biting us in the butt again?
Well, I think any vaccines that can get to New South Wales, the better. Any vaccines that can get to Victoria, the better. We need more vaccinations. A lot of people talking about hesitancy. That is not the main problem at the moment. What we have is a lack of supply. But going back to what's sort of happening in terms of public health versus individual responsibilities, what we're seeing now is an advertising campaign which is about individuals doing things. It's about looking after yourself. It's about the threat to you as an individual. And there's been a lot of talk about the 4-phase plan that the federal government released last week, and that only moves into the second phase, which is where we try to avoid lockdowns, or we only have them as a last resort. When we get to a point of vaccination in the country, that is going to be what the Prime Minister described as a scientific number. So we reach this scientific number, which is a threshold at which we sort of say, okay, now we can open up our economy more, we can open up the borders more, we can open up, we won't be shutting down between states, etc., like we are at the moment. Now that number cannot be a scientific number. This is a judgment call that has to be made by our leaders. And there's the Doherty Institute who is modelling that. They might come up with a number, but it has to go through a lens of government policy and decision making, which is.
I'm going to stop you. We can really feel for New South Wales, but I still can't blame the people. It was politicised. It was turned into a political thing. It was red versus blue, and we've been told. I put it down to being like the Democrats and the Republicans in the US. We've been told not to pick on New South Wales because they didn't know better, but they had us. They could have learned from us and what we went through.
It is really sort of sad seeing it unfolding at the moment, and you see the regional lockdowns and you sort of see the half measures, and you just think this is just so much like. This is so 2020 at the moment. It's so July 2020.
It feels like
Victoria.
We're back.
And you keep wanting to say to them, don't do this because we know how this ends. You know, do it once, do it properly, do it together, finish it, get rid of it.
Stay home.
Staying home. And this is the economic sort of side of it as well. So we had JobKeeper, which has now been removed. In Victoria's second wave was the fact that JobKeeper existed. So it took a lot of financial pressure off people who might ordinarily have to go out and work or might feel that they had to do that. So the financial side of it is really, really important for the health side of it as well. And again, the government at the moment, at least today, has not said that they will reinstate JobKeeper, and that is a priority for them to think about. That is again the politics of it. These are policy decisions that are affecting health. So it's not just an individual's responsibility to do something or to not do something. It's how have we constructed this society in New South Wales at the moment so that it's very easy for people to make the best decisions that they can that helps New South Wales get out of this crisis as fast as possible. Even the fact that there are shops, unnecessary retail shops open means that people have the option to go and do it if you're bored. I mean, in Victoria there was nothing open.
There was nothing.
You couldn't do it.
No.
So what were you going to do? Well, you did stay home but we had the financial support as well.
But JobKeeper and such like. What it did also enable was the economy to keep flowing. If we shut down the shops in Melbourne, the retail outlets, the extra shops and everything, we're doing it for each other, we're doing it for Melbourne. They shut down the gyms, we're doing it for Melbourne, we're doing it for Melbourne. If they had shut down the cafes, I reckon there would have been rioting in the streets from everyone.
Absolutely. Because there were,
you can't live without a coffee in Melbourne.
There was the time when there was just the little thing that you could do. The one little freedom.
The one freedom was
you could still go and do that.
Is it up to the government to enforce that? Is it because the government knows better what we should be doing?
It's because the government has the policy levers at their disposal. So individuals. You can all act as individuals, but the government really has all of those big policy levers. That they can do the things. So I make the analogy, let's say with a sporting team or something like that. So a sporting team, if you're a really great team, you have great leadership, you have a great coach, you coordinate the actions of all the individuals. Sure, they're all individuals, but you're coordinating them. You're telling them how to do things. If you're a great army leader or something like that, you don't just sort of drop them all off at the beach and say, well, use your common sense and just look after yourself and there's no common sense just doesn't work. You have to coordinate it. You have to have a plan. You have to have a big picture that you're driving people towards, and you have to be saying, if we do all these things together, we're going to support you. It is a sacrifice. We will support you, but this is where we're going to get to, and here's the reward here. I mean, the 14-day rolling average. Remember the 14-day rolling average? That was it wasn't a marketing thing, but it kind of was as well, because it gave people a sense of, well, what is important here, and what is it something that we can watch the momentum of it come down. And everyone was obsessed with the rolling 14-day average, and it worked very, very well.
Anthony Migger, this is for you, mate. Excellent job with the COVID Live website. It is everyone's Bible. Nationwide now, I bet you there's a lot of New South Wales people every morning going, COVID Live, not updated yet.
And it is kind of sad that someone like Anthony has to create something like that, and it doesn't, in his own time, it doesn't just exist. I mean, this is sort of information that should be out there. But again, all of our modelling we weren't officially asked to do it until very, very late in the piece. Yeah. And since then, no one sort of asked us to do any more either. So whatever. If you want to try to do some work that's really like high friction and using the most convoluted network possible, you would try to do it with GP networks, because they're actually lots of small businesses. They're just a big bunch of small businesses. You can only contrast that with places that have done mass vaccination really well. Mass vaccination hubs, walk-up clinics, walk-in clinics, walk-through clinics, around-the-corner clinics. You have to run into the vaccination. You can't help.
Yeah, you can't.
So you have to wonder why it was decided to go through the GP clinics, and I think it's a naive assumption that a lot of people even have a GP. I mean, my PhD's in medicine. I'm in the health sector. I haven't seen a GP for 5 years. I don't have a GP. I live in a country town, and there is no GP in my town. I would have to drive 40 kilometres away to go and even see a GP. So I was lucky that I could go to Bendigo Hospital and get a vaccination. But I have no connection to a GP. The whole plan, as far as I knew, was we were going to get out of the second wave. We have this time that the rest of the world doesn't have. We use that time very smartly to get our vaccinations up. When we get hit by a new variant, etc., it doesn't matter, because we're 60, 70, 80% vaccinated. We wasted so much time between November and May this year, not being in a race, expecting that it was all just going to be okay and it was gone. It's obviously not gone, and we're in a lot of trouble between now and October, I would suggest.
We did this without a vaccine. We did it twice without a vaccine. We did it third time, and the vaccine started coming. We had the fourth time, and we got the vaccinations up.
And it is a shame that New South Wales seem to get themselves into this narrative of, well, we don't need to lock down. And there's, were they confusing talent with luck? Who knows? I have to say there was some epidemiologists who were saying, this was unnecessary and we didn't need to go into lockdown. And these are the same people who sort of said that Victoria should have had a more nuanced approach, and were sort of critical of what happened in Victoria as well. If you continue to roll the dice, you will get it wrong.
Yeah, eventually.
And you need to get it wrong once, and it's gone. And that's what's occurred. It's far better to be safe than sorry in this situation, because if you lose it, it's like dropping a glass. It hits the ground. You don't have another chance of picking it up.
Tell me, you've obviously been working in this area for a while. What do you see when you compare it to cycling and shifting the blame?
Well, this is really about public health and who wants to take responsibility for the generation of illness and injury and death in society. So my view is that the government manages the transport system, and the transport system generates X deaths and X injuries a year. It is while we all have a responsibility to drive and ride as safely as possible, crashes and the number of crashes that we have are entirely predictable based on the way in which we've created this system.
In one area in our society, the government wants to blame no one. And that's the area where we've got the most control to actually find blame.
I mean, I think the no-fault schemes are good. I think that there has to be justice on the side of that as well.
Yeah.
There has to be more justice for people. And so when I was at the TAC, the work that I was doing there, which formed part of my PhD, was in. Was the good thing about the TAC is that the staff there working, the people who are in the building, they work with clients. So as you're wandering around, you can hear people talking to injured people. And one of the things I always used to hear people saying was, to injured people, yes, I know this crash wasn't your fault and it shouldn't have happened to you, but, and then explaining X, Y, and Z. And at the same time, I was working in client research, which was really looking at how people recover after crashes. So whether they were, how much money was spent on their treatment, whether they went back to work, what their mental health was like, what their physical health was like. And we're always working on projects and programs to try to make people's recovery better after having a crash. And I asked the policy manager at the time, I said, do we ever ask people whether they think the crash was their fault or not? And he said, no. And I said, why not? And he said, well, this was a no-fault scheme. Everyone gets the same benefit, so it doesn't make any difference, whether they're at fault or not. So I was very interested in this idea. So as my guess was that people who were not at fault in their crash would have much worse recoveries than people who were at fault. And so I trawled through 1,000 police records of people who had had crashes. And the way the police organise their reports is car A is usually the car that crashed into car or object or person or cyclist B,
yeah.
And then there might be a C or whatever it is. But you can pretty much guess that car A is the person that did the thing.
Yeah.
And when we looked at, and then I got all the records of those people and their hospital records and everything and compared them all. And what we found was that people who are not, if you control for the same injury, let's say I've got a broken leg and it's exactly the same broken leg as your broken leg. If you crashed into me, I'm 3 times less likely to have gone back to work. I'm 3 times less likely, 3 times more likely to suffer anxiety and depression as a result of the person who crashed into me. So fault, even though it doesn't matter from an administrative perspective, it absolutely matters for individuals and their feelings of justice and their feelings of control about being on the road, in the road environment, and being able to stop crashes happening to them again. Because if you've been just sitting at the lights and someone crashes into you, how do you stop that again? If you're a driver and maybe you were drunk or maybe you were distracted or maybe you just made a mistake, you can rationalise and you can think, that was really bad and I broke my leg, but I won't do it again. Whereas if you're the victim of a crash, how do you stop idiots? And I'm blaming them. But how do you stop other people crashing in the future? Yeah. You can't. So it's anxiety provoking. Cars kill something like 1.2 million people around the world every year. They injure 50 million more. They are around about, I think, the 8th leading cause of death and disability in the world, and it's a machine that we invented, and it doesn't seem to matter. No one cares.
I do appreciate your time today. It's been absolutely eye-opening and fantastic, and I really do appreciate it. Is there anything else you'd like to add before we close off?
It's just that I've always been obsessed with transport, to be honest, and transport systems. I've got a motorbike, I've got 3 bikes, I've got an electric scooter, I've got 2 cars. I'm just like, I like just trying them all and having the best
option.
and the worst. Well, I like the perspective too. So I'm always trying to think about how are people operating in this system, and how can we make it better. So we continue to do research in our group about trying to make transport and health systems better, and hopefully we have some sort of impact into the future.
Excellent. Thank you very much, Jason.
Thanks
I really
so
appreciate your time. It was absolutely fantastic and great catching up with you. Thanks very much.
All the best.
So hope you got to the end of the video. It's a long one and I'm not going to cut this down very much either. It's everything in its good value. So hope you got to the end of it, and whatever you do out there, remember, stay informed.